Here at the Utah State Hospital, we focus on mental health treatment, specifically some of the most severe mental health cases here in the state. So a lot of people with psychotic illnesses, that sort of stuff. And one of the things that we specify here in our building is forensic treatment. So those are the individuals with mental illness in the court setting. Typically, they're going to be here for competency restoration. That's the majority of the people that we treat. Additionally, we've got people who are guilty and mentally ill receiving treatment as part of their sentence, or people who have pled not guilty by reason of insanity. I'm going to talk a little bit more about the competency restoration folks. So probably 80 to 90% of our patients at any given time are here for competency restoration. And a while back, we were having some issues with long wait times. People, before they come here for treatment, wait in the jail. And they were waiting in the jail for far longer than is helpful for them. And so what we wanted to do as a system is we wanted to improve our internal efficiencies, look at some flow, and so we looked at some synchronicity things that we could do to improve how quickly patients could get through the system and help them get treatment faster.
At the State Hospital, we applied the concept of synchronization, and we did that by establishing a planned discharge date. So clinicians actually looked at a patient, their diagnoses, what it would take to restore competency or improve their functioning and quality of life so that they could move on from the hospital. And they established a planned discharge date, and then we used that date and synchronized all other activities to that date. Their treatment, any rehabilitation, tasks, other therapeutic activities, and synchronized and sequenced all of those things to meet the planned discharge date. And in doing that, we were able to improve the treatment, the quality of the treatment, and the quantity of the treatment, and improve the flow of individuals' progress through the state hospital system so that they could be discharged by that planned discharge date and move forward to the next phase of their lives. And it was really key in making critical improvements at the state hospital.
In January of 2018, when we started this, the wait was around 150 days to get into the hospital. And at the time that we reviewed our data again in August, we had shortened that wait from nearly 150 days down to 45 days. From that time, we've seen continued decreases in the wait time. Within the course of just a few months, we were able to bring in more patients than we had the year before and just overall speed up the process. And so the idea is that we want to get them the treatment that's least invasive. And so by providing these 3 levels of service, we're able to get them the treatment they need faster. Additionally, by highlighting the things that we're slowing down within our own system, we were able to improve some of those workings so that we could speed things up and provide better treatment. And the way this helps just the whole system in general is, one, the patients benefit. They don't have to wait in jail for months. They're getting treatment faster and they're getting what they need faster. And then of course it benefits the taxpayers and those in the state simply because it's not as much of a burden on the system if people are moving through at a faster rate. And so that's the ultimate goal, is that we're just improving our speed, we're improving the services that we provide so that we can help the patients the best we can.